Hey everyone, it's Raj from 3CB. The Brooklyn Nets announced yesterday that wing Ben Simmons will undergo a low back procedure called a microdiscectomy to alleviate the pain that he's been suffering from over the last year and that kept him out in the playoffs. Let's start with a quick primer on spinal anatomy. There's bones in the spine called vertebrae, and they're designated by region and by number. So in between L1 and L2 in the lumbar, you have a disc. In between L2, L3, you have a disc, so on and so forth. Those discs are often conceptualized as a jelly donut that has a tough outer exterior and a soft jelly-like interior called a nucleus pulposus. Over time, you can develop micro tears in those outer fibers, which over time and repetitive stress can lead to holes developing. And then that jelly, the pulposus, can leak out and cause irritation. The more irritation there is typically, the more symptoms there will be farther away from the back, potentially into the legs and then into the feet as well. In a microdiscectomy, the surgeon will go through part of the bone and remove out that pulposus that is causing the irritation. The typical return timeline here is 2 to 3 months for NBA players, and some of that will depend on the specific level of the disc, as there's some research showing that the higher up the disc is, the quicker the return to play timeline. We're not privy to that information as of yet. Regardless of that, Simmons will then have a significant ramp up period because he obviously missed the entire season, and now he'll be down for the count with limited mobility and conditioning for the next 2 to 3 months as well. The Lakers' Dwight Howard mentioned this past season that when you don't play for 2 games in a row, it dents your game fitness. Imagine now for Simmons, who will be out for 15 plus months. There is good news here on the return to play and performance, as especially in recent years, we've seen a very high rate of players coming back and also returning to their pre-injury levels of performance. The last aspect to mention is re-injury rates. Some research shows about a 10 to 12% re-injury rate over the course of the next 5 to 7 years following the surgery. And part of that is because that outer part of the disc doesn't heal in the same way. There's gonna be scar tissue, which isn't the same model, and therefore it's not quite as strong as the original, which can lead to higher rates of prevalence for re-injury. Last but not least, you might be wondering why Simmons and the Nets tried to have him come back during the playoffs when he now is having surgery. Well, there's plenty of cases where a player needs surgery after the season but tries to manage it in the season. The Sixers' Joel Embiid with his thumb injury here is case in point. That's part of what comes with being at the highest level, and you have to analyze the risk reward, and the Nets have one of the best medical staffs in the league, so it really becomes a judgment call in that case. I'll keep you updated as we learn more on Simmons' rehab and return to play.